everyone, if you are jumping onto this video because you want to find out more about hydroquinone and you're wondering if you should use it for age spots, acne scars, or melasma, we're going to be talking about what hydroquinone is, what it does, and some pro tips on how to use it if you decide to use it. Hi, my name is Christy and I have been treating clients for over 11 years specializing in hyperpigmentation, acne, and other skin conditions. And so today we're going to be talking about hydroquinone. Hydroquinone is a skin bleaching agent. You can get them in two ways. You can get them both for over the counter, which is 2%, or you can get a higher percentage, typically 4% from the dermatologist, or a combination of 3 ingredients that one of them is going to be hydroquinone. So hydroquinone is most commonly prescribed for skin conditions such as melasma, age spots, lentigines, acne scars, and freckles. Hydroquinone can come in creams, emulsions, lotions, gels, or solutions. So how hydroquinone works is it blocks the enzyme tyrosine from converting to DOPA, which stands for dihydroxyphenylalanine, which is basically reduces the amount of pigment, which then results in lightening of the skin. So before we move on to the pro tips, if you're finding this information helpful and you've been watching our hyperpigmentation playlist and you still haven't subscribed, we would love it if you hit that subscribe button, hit that notification bell to get notified when our videos go up, as well as to give us a thumbs up to support our channel. So if you decide to use hydroquinone and you use it in a combination, or if you're just using it alone, whether it is a retin-A, retinol, any type of retinoids, AHA such as glycolic acid, in addition to that, hydroquinone, any of those ingredients that can make the skin photosensitive, which means your skin is more likely to burn easier. So when you're using these ingredients, you must wear a sunscreen, because if you're not wearing sunscreen, when it makes the skin more photosensitive, you actually can produce more melanin. And if you're trying to lighten your skin, it is actually doing the opposite. So that is the first thing. The other thing is, if you are using hydroquinone in a combination of what is called, sometimes referred to as triple cream, sometimes they combine hydroquinone with tretinoin and a corticosteroid to reduce inflammation, you still have to wear sunscreen. Now, some of you decided that you guys wanted to become cosmetic chemists, and some of my clients started using hydroquinone and combining with all these other things. We're going to be talking about that in the pro tips. So here are some of the side effects that can happen, whether right away because your skin is more sensitive or with prolonged use. So some of the side effects can include itchiness, dryness, redness. Sometimes some people get blistering and oozing. Some people have also developed contact dermatitis, which is essentially a rash when they are using it, whether it's the first time or after prolonged usage. And actually, speaking of prolonged usage, some people have also formed what's called sclera, which is pigmentation formed in the whites of the eye or the iris of the eyes. It's a pigmentation. Also a thing called pseudo-yellow nail syndrome, which is basically the yellowing of the nails because of the oxidation and polymerization of the byproducts of hydroquinone. The other one is ochronosis, and ochronosis is basically a bluish black pigments that form on the skin, and on top of it is caviar-like yellow papules. And that was actually formed by a lot of women that were in this study done in South Africa. And this was again due to prolonged exposure of using hydroquinone, which is why they recommend that if you decide to use hydroquinone, they do not recommend using a regular usage of hydroquinone past 4 months. So here come the pro tips. The pro tips are basically, if you decide to use hydroquinone and they say to use it for 4 months straight and take a break, well, if you are not using any skin bleaching agent or any tyrosinase inhibiting products, that melasma, acne, hyperpigmentation, freckles, lentigines, anything that you're using it on can slowly return. So the pro tip is, first of all, that Don't use it past the regular 4 months. Take a break. But when you take a break from that, you may want to use other products that may not be as harsh to the skin as hydroquinone, and you may want to use other things that we had mentioned in our other videos in the hyperpigmentation playlist, and you may want to check those out. And those include a lot of the natural ingredients, which keeps the hyperpigmentation from coming back. The other thing is that if your hyperpigmentation is very close to the eyes, the nose, the lips, they do recommend that you avoid those areas, because those areas are obviously, the tissues are a little bit more sensitive and prone to sensitivity. Now, if you're watching this and you are in Japan, the European Union, or in Australia, this ingredient is actually banned. Now, as far as the US is concerned, the FDA actually banned this, or proposed a ban on over-the-counter products containing hydroquinone back in August 29th, 2006. And this was in connection to a study that was done. It was not done on human skin. It was done actually on rodents, where it had some links to be a carcinogenic agent. Now, there has been some studies that were actually done on humans where people who were consistently using hydroquinone, they did find that there was abnormal function in adrenal glands, as well as abnormal higher rates of mercury in their system. People who were using hydroquinone. So as of right now, it's not banned, and this is why sometimes you will hear some controversies that go on with hydroquinone. I am just here to tell you just the facts of hydroquinone. It is a personal choice if you decide that you want to use hydroquinone. I'm just telling you just some of the tips on how to use it to make it more effective for you, and just some of the side effects that can happen, not that it will happen to you. Some of the more popular names of hydroquinone, there's actually quite a bit of them, is Triluma, Lestra, and Epiquin Micro. Okay, so here are some of the pro tips. First of all, as I mentioned in other videos, make sure that you exfoliate quite effectively if the exfoliation is a rinse off, because we don't want to leave on your glycolic acid serum or any type of AHA serum and then put the hydroquinone on top of it. You are more likely to develop sensitivity. So use a AHA-based exfoliant that you can rinse off, and then on clean, dry skin, apply the hydroquinone directly on the dry skin. Do not mix and match your vitamin C serum, your kojic acid serum. Just keep it simple and put it directly on there. And the reason why I'm saying this is, over the years that I've treated clients, they all think that because they watch YouTube videos that all of a sudden now they are a skincare expert or a cosmetic chemist, and if they're thinking, ooh, hydroquinone is a skin bleaching agent, if I use it with this other lightening, brightening ingredient, it might work better. No, if you're using hydroquinone, put it directly on the skin. Let it dry completely before moving on to the next step. The other pro tip about hydroquinone is to, like I mentioned before, when you take a break from hydroquinone, then that is when you can bring out your niacinamide or your vitamin C or your kojic acid or whatever that you are using that is a tyrosinase inhibitor. So use that for several months, and then you can go back to using the hydroquinone if you choose. I mean, I do have some clients that they use the hydroquinone. It helps fades it. They use their tyrosinase inhibitors, and because they use it on a regular basis, the melasma doesn't seem to return. Of course, unless you go out to somewhere, like a lot of my clients will go to Hawaii for a week or two and they're getting way more sun than normal, then they see that that pigmentation slightly is coming back, and then they can return to the hydroquinone. So those are some tips to give you better results if you decide to use hydroquinone. So if this is your first video that you're watching based on hyperpigmentation list in our playlist and you haven't caught the other ones that I have cited some studies where hydroquinone gave much better results, by up to 50% better results, if you used it with a professional treatment. So whether it is laser, whether it is an acid peel, and using hydroquinone when it is mixed with kojic acid or tretinoin and a corticosteroid. It is much better. Hydroquinone seems to work when you use a combination of things. And this is not a personal recommendation because I cannot see you through the camera lens. Make sure you see a professional and they can recommend based on your Fitzpatrick skin type what is best for you, especially if you have darker skin, which is technically Fitzpatrick 4 through 6. Please make sure you see a professional before going into more aggressive treatments, and check out those videos in our playlist. Now, after watching this video, if you decide that hydroquinone is not really for you, that's okay. You can watch some of our other videos that explain what tyrosinase inhibitors are, which actually helps fade some dark spots and hyperpigmentation naturally. I do warn that it takes a lot longer than the other combination of treatments, but if that's the route you want to go to, then just know that. Because remember, makeup is an art and skincare is a science.